COVID-19 is a respiratory virus, so like other types of respiratory viruses that we have seen for many years, including influenza, the best thing that we can do is stay home when we are symptomatic. If we have a cough, congestion, shortness of breath, respiratory symptoms, stay home until those symptoms are gone. We should avoid contact with as many people as possible if we think we do have COVID-19. Certainly as a precaution, if we're out in public, wash our hands with soap and water for 20 seconds at least. Use an alcohol-based hand sanitizer if there is no access to a hand washing facility. Cover our cough if we are ill with something, and then again, just stay home when we're ill. If you suspect that you might have COVID-19, certainly call your healthcare provider in advance of going into the clinic. They can talk you through your signs and symptoms and exposure history on the phone to determine if they want you to come in for influenza testing, for respiratory virus panel testing, or even the COVID-19 testing. This virus is impacting more of the older population and those with underlying health conditions. Worldwide, we're not seeing the significant health effects for the younger population that we are in some of our older population. I heard a really good analogy about a month ago when an individual on a conference call said the best time to evacuate for a hurricane is while it's still sunny, right? So be prepared. If you trust the officials to say this is coming, be prepared. So if we wait until 30-40% of our residents are ill with something, with anything that's highly contagious, then that's when our resources can get overloaded, when potentially the hospital systems get tapped out, the beds have been used up at the hospitals. So if we are able to slow the curve a little bit and we can implement some of these public health recommendations like limiting the number of individuals at public events, potentially even looking at closing schools and other large gatherings, then the spread in the community will slow down. It will still spread, people will still have that contact, but it will slow down, and potentially it will allow our hospital systems to be able to manage the patients that they have on a smaller, slower scale.